Today I'm going to talk about the working relationship between optometrists and ophthalmologists and why it's so important. Okay, so how many times have you wondered, well, that's not where I want to start. There's really no secret exactly to what ophthalmologists do or the main difference between the two. I mean, if you want to look it up on the internet, it's there. I want to help you understand the exact difference rather than just to know what it is, because I think people still don't quite get it. And one of my focuses, like my background on this topic is, one, I have a public health education degree, which makes me want to communicate I have a responsibility and obligation to my community and environment to communicate things effectively in a way that will provide understanding for everyone involved and make it easier for you to access your providers. I also have worked with optometry since 2010. So in that time, I discovered that I wanted to pursue a career as an optometrist. So I have experience in the business side of that, background side with patient care, and as an optometric technician. During this past year, I have been working with an ophthalmology practice, and so I have some experience with what they do and just seeing the day-to-day things because I work with the diagnostic equipment. So my video today stems from a question that I received yesterday from a gentleman, and it's not just him, because many people have asked me this over time, and I'll give them an answer, and then they don't still seem to get it because the question that follows. So the first question that usually starts with is, what's the difference between an ophthalmologist and an optometrist? So right off the bat, I'm going to start with optometrist. Optometrist does more of your routine, day-to-day care, and then they also specialize in refractions and contact lenses. And while ophthalmologists, they are medical doctors who have went to med school. Optometrists only went to optometry school for it's a 4-year program. But back to ophthalmologists, they went to ophthalmology school after going to med school, and so they have that specialization, which is 8+ more years in their fields. And offhand, they do surgical treatments of eye diseases, and they specialize in the treatment of eye disease. So essentially, that's what the big difference is between them. And they can correct refractive errors, ophthalmologists, by doing surgeries like LASIK and cataract issues. But I have observed some other differences that I'll bring up later, because I'm going to get to the second question. So the second question that immediately followed after that question really helped me to see that people really don't understand the importance of their differences, because his question was, well, who's more important? Who's more important? And from that question made me realize that one thing, people do not understand the importance of preventive care and routine care versus treatment and after the problem comes. And for one thing, preventive, like we'll go back to the optometrist. You're going to do your routine. They have went to school for refractions, so they can overcome a lot of refractive errors. They're going to spend a little bit more time with their patients, on average at least 15 minutes versus 10, and most times 20. Some may even do more as optometry, and they're going to do more of the direct stuff with you versus what the optometrist technicians are going to do: the pre-workup history, check your acuities, and maybe some other stuff. But most of the optometrists are going to do your full scope exam. And ophthalmology, they have ophthalmic assistants who will do a lot of your pre-workup stuff plus your refraction. But even though they can do refractions with their certification as a technician, ophthalmic assistant, however, they don't specialize in refractions like optometrists do. And there were key things that they didn't do that optometrists did, which is like, checking your ad powers and stuff like, pinpointing the trouble issues. So I would say it's important to have both types of doctors in your life. Right now, for people like me who don't have any eye-related diseases, I'm not seeing an ophthalmologist at this point. Right now, I see optometrists, and I do year to year. And so I don't have diabetes or anything else that would need to be managed regularly. So I do more as prevention. So when I go there, I expect to be dilated, and I do the retinal photos to have a background of to track any changes that may happen to my eye over time. Because with eye disease, it can creep up on you like glaucoma, and some of it is not reversible. So glaucoma is not reversible. They can stop it from getting worse, but it is not reversible. So you want to catch that as soon as there's any sign that you may be a suspect. They can start working on things to kind of get you back on the right track. And so at that point, that's when I would, as I got older, if I start to see if I have signs for glaucoma or any kind of, like if I get diabetes and I have diabetic macular degeneration, anything like that, I'm going to start seeing an ophthalmologist because they can treat the problems that I have. And a lot of the ophthalmology practices have more equipment than you would have at an optometry practice. So at ophthalmology practice, you have access to most time visual fields, OCTs, photos from an Optos versus an regular fundus camera to get a full scope exam while you're there. And you can bill it under your medical insurance with your specialty copay versus you go to routine for your optometrist. You're going to pay a lot more out of pocket for those specialty tests unless you come back as a medical office visit. But then you have to have a diagnosis to file with, and there's a lot of traps in that. So you have to really know the key differences so you don't get thrown up in the mix. What I will go further to say, because let's see, I think that's all I wanted to say for right now. Because you're going to spend less time on average with your ophthalmologist than you would with your optometrist. But I do stress the importance of having both doctors involved in your healthcare, especially as you get older and you do suffer from eye disease. So once you start suffering from eye disease, it is important to maintain a working relationship between the two. And how they do it behind the scenes is your optometrist would refer you to an ophthalmologist once they pick up on signs of eye disease like glaucoma or macular degeneration, anything like that, because they're specialists. So, like for you to a retinal specialist to treat that, anything like that, you're going to get referred out. So from there, and because they will treat you and monitor you, but in good faith, most ophthalmologists will refer you back to your optometry practice for routine care, as in with your glasses, contacts, anything like that. They're going to refer you back in good faith because that's how they maintain that working relationship. Because that way the ophthalmologist can focus on getting more patients to treat those medical diseases. And there's so many people that see an eye doctor on a regular basis. I wish you guys knew. It's crazy. Like even me as a person who has worn glasses my whole life, practically, when I was first exposed to the eye care industry in 2010, I was so shocked as so many people call an eye doctor in one day in my area. It's ridiculous. So there's just what's the word I'm looking for? There's more of a higher demand for care. So that's why it's important to Um, Find a good doctor. That's the main thing I would say that can differ between any doctor. Find you a doctor that is passionate about what they want to do, that loves people and loves and has good reviews across the board for being valuing you as a patient. That is essential to me. Um, I have worked with providers who are not people, and they do not love what they do, and it's about the money, and everything that they do is a reflection of that. Whether they don't interact with the staff well, they're just usually miserable. And to begin with, you don't want a doctor like that. So the main thing to you is just research your doctor. Because if you research a good optometrist, they're going to have your best interest at heart at all times, and they will refer you out when you need to be referred. You go to an ophthalmologist, they're going to keep your best interest at heart, that, the ones that really care about what they do. So it's just, go to someone who is going to be invested in your health care just as much as you are, and they will guide you in the right direction. But back to the video. So that's the main importance behind the working relationship between the ophthalmologist and optometrist. They do different things. Yes, ophthalmologists can do more because they have a higher level of degree, and they can. But just because something is permissible, it doesn't mean it's expedient. So you really have to consider: is this I can get contacts from my ophthalmologist, but they don't specialize in contact lenses. So I'm not going to probably get the best, highest quality of contact lens that I can get if I had went to see an optometrist. You see what I'm saying? So you just have to research something through and then look at the full aspects. Everybody's good in their own right. Look at the difference. So what do they treat? Who does what? It's a working relationship, and these professions are here for a reason. So research your reasons why you're here, and it'll be clear to you. But that's all for today, y'all. I hope I just helped you understand the just give you a little bit more understanding about the importance of the two professions, and I hope that you'll find what you need. Have a nice day, and please comment, rate, and subscribe, and I'll talk to you later. Bye.